Welcome to the 3030 Health Podcast. The following discussion is for education and entertainment. It is not intended to diagnose or treat disease. Please do not apply any of this information without first discussing it with your doctor. Here is your host, Dr. Ruiz.
Hello everyone, Dr. Ruiz here with another episode of the 3030 Health Podcast. My guest today is Matt Standridge, the Ketodontist. I hope you enjoyed the show. Hello everyone, super excited to be here with my friend Matt Standridge. Matt, how are you? Oh, I should say, Dr. Standridge, how are you?
That's all right. I prefer Dr. Matt. It's the best of both worlds. But anyways, I'm doing well. Thanks for having me.
No, my pleasure. It's funny. A couple of years ago, I was watching some of the videos from the Ancestral Health Symposium, and I'm not sure you're familiar with Mike Mew's work. That dude was talking about the ancestral connection to dental health, and of course, everyone's familiar with Weston A. Price. So I've been geeking out about this stuff ever since. I had a couple of cool doctors, the authors for the book Jaws. Have you read that?
Actually, it's funny that you mention it. I just got it in. I haven't had the chance to read it yet, but I just got it off of Amazon. So.
Fantastic read, man. So it was like a big moment of like self-reflection, because like in medicine, sometimes there's like, what you eat doesn't affect your health. And when I was watching Mike Mew, I never put together that the exercise of chewing affects the structure of your cranium. But before we get into that and chewing on that subject, no pun intended, what's your hero story? How did you come into this health space of ancestral health?
Yeah, you bet. A lot of it really started with my own health. I grew up overweight as a kid, and I'd always battled my weight. And I wasn't just chunky; I was morbidly obese, and unfortunately, my mother was too. And it wasn't until high school that I started learning low carbs. That's kind of when the Atkins thing came back into vogue, kind of late 90s, early 2000s. And I actually picked up the book and I actually read it cover to cover. And what he was talking about with carbohydrates, especially refined carbohydrates, and the role of insulin and hyperinsulinemia, it just made a lot of sense to me. So I started implementing it, and I lost about 130 pounds. And I kept it off all through high school and all through college. So that's what got me into kind of this diet lifestyle aspect. And then I lost those health gains that I made actually in dental school, because with lack of sleep, stress, lack of movement, just in a classroom all day and studying all night and everything. And also I had nutrition professors touting the dogma, the conventional dietary advice. And they were actually calling out kind of these low carb things. Paleo wasn't quite on the scene yet, so they weren't calling it paleo. But so I listened to them. I started reintroducing quote unquote healthy whole grains back into my diet and lowering my fat and all that stuff. And I gained all my weight back and then some. And so since 2016, I got back on the wagon of learning, getting back to my low carb roots, but also diving for the last few years. I'd also really dived into this ancestral health model. Started with Rob Wolf's book, Paleo Solution, and then just snowballed from there. That's actually you talked about, we all know about Weston A. Price. What's funny is that most dentists don't know about Weston A. Price.
That is hilarious, actually.
Because I actually didn't know about Weston A. Price until I read Rob's book. And that's what's introduced me to him. Then I picked up his book, started learning more through the foundation and all of that. And so, yeah, it's actually kind of funny because I never heard his name that I remember in dental school once. And then to find out what this guy did is incredible. So anyway, long story short, I've adopted a ketogenic paleo diet, and I'm down over 90 pounds as of today. I still got more to go, but it's getting there. I went through Mark Sisson's training, his Primal Health certification course. So certified Primal Health coach, and I use this for myself, obviously, also with my family, and then really broadening it out to the community, to my patients, and all of that. And so, yeah, that's where we're at.
For people that might not know about the connection between what you eat and refined carbohydrates and your oral health, I think that soda with high fructose corn syrup or sugar, even if it's natural sugar, it's a very short stretch of the mind to see how that can affect your teeth and rot them. But what about, how does a person benefit from modifying their diet and consuming the carbohydrate load that they should be using?
And that's the thing. There is going to be some individual variance on this, depending on the microbiotic makeup, the strands of bacteria and their viral load and their pathologic load in the mouth. And so some people can get away with more carbs than others, just like they can with their weight and with their just general inflammatory issues. But really, carbohydrates is the smoking gun as far as dental disease goes, as far as cavities go. It's kind of the smoking gun, and then the second being acid. Really acidic foods, but not just really acidic foods, but the frequent exposure, the frequency of it is, those are the two biggest things that really determine the health of the mouth. And so I tell my patients all the time, because I'm not carnivore. I still eat vegetables. I still eat a lot of broccoli, cauliflower, lettuce, spinach, kale. So yes, technically those are carbohydrates, but I tell my patients broccoli never gave anybody a cavity. It's like you said, soda pops, fruit juices, energy drinks, sweetened coffees or teas, breads, refined carbohydrates, like in junk food, like potato chips, pretzels, that type of stuff. So
when it comes to acidity, we think of different foods as being healthy, like for example kombucha and apple cider vinegar, or those can be helpful for you, but we can definitely overdo them, especially with kombucha. It's basically healthy pop. It does have a little bit of good bacteria, but is it worth it? And that's a 1-2 punch, because the yeast, when you're brewing the kombucha, makes it a little bit more acidic. Now, okay, before we get into that question, okay, you are in the middle of the Midwest, aren't you?
Yeah, basically the very center heart of America.
How is that conversation? How prevalent are your health food stores and your paleo inspired menus, and then how is that conversation with your patients? Because I'm gonna tell you a story. When I was going to naturopathic medical school, it was a bunch of hippies going to the school, me included. And and we were like, oh, what supplement are you taking? And check out my gluten-free sandwich or whatever, and it was like very, we would talk this language of health and everyone understood it. And then I started doing medical rotations, and we go outside of the bubble of the campus, and people still smoke.
Yep.
People
Yep.
still,
Exactly.
they have, their big, 64-ounce sodas that are not, saccharin or ASK. I was like, oh, shit. So what is the conversation like in your everyday to-day life?
Right. And that's difficult. And really, one of the things, like, because with how I approach in my practice and then also in my community, it's a little bit more scaled down compared to if I was trying to teach in a more affluent area or in a more health conscious area. I have to start with the very basics. Like you said, you walk out of the bubble and oh my God, people still smoke. Yeah, I mean, I see a lot of teeth that a lot of my dentist friends who don't see the type of ravages that I see because it's just not prevalent in their location. They see what the type of cases I'm having to do, and they're like, "Oh my God, was that meth?" They just automatically jump to meth. I'm like, "No, that's convenience store mouth. That's a big gulp of Mountain Dew and Funyuns. That's what led to this state." So yeah, I really have to focus on the bare bones starting out and kind of gauging where people are at, and if they're even ready mentally, if they're, because if a person, like, you treat patients, if a person isn't there willing to make the commitment just yet, you're just going to be basically talking to a wall, right? And so that's where I kind of start off at. And if folks really want to take control, I kind of go through kind of the basics with them, talk to them about reducing sugar and carbohydrate consumption to levels that are appropriate for them. Also, lifestyle behavior change. So, if they're interested in smoking cessation or anything like that, and then just kind of gently guide them through a process. Maybe even have them fill out like a 3-day food journal. They can bring it back, and I can kind of look over everything and then kind of point things out about, because I have them not only record what they eat, but when, so I can see what meal timing is like and frequency and all of that. So yeah, I start pretty basic with folks, and then just kind of walk them down the path to wherever to the level that they're ready for.
Well, and thanks to the internet, we can have this conversation, and thanks to the internet, there are people like you in the trenches, doing what should be done at the base level. And hopefully, and that's why I do this type of podcast, to help people, and maybe we can have this conversation, and you can put it on your plan and say, hey, go listen to episode blah blah blah, and I talk about the basics. So let's start at the beginning, okay? How do we protect our teeth? How do we protect our mouth from acidic foods? Whether it's like you're drinking a soda, or you are drinking 4 ounces of kombucha, or you want to take a shot of apple cider vinegar to help with digestion. Let's say, how do we protect the mouth at that point?
I mean, it depends on what folks are able to do. A few things that I like. So getting down to how pH works in the mouth, so folks can kind of understand the mechanisms of this. Whenever we eat or drink something acidic, dealing with pH, our resting pH ideally is at about around anywhere between 6.5 to 7, so about neutral. Most enamel damage happens at a critical pH of 5.5 or below. And so whenever we consume something acidic or sweet or something like that, the pH of the mouth drops. And our teeth are in this constant shifting between demineralization and remineralization. So, mineral loss versus mineral gain or uptake. And at least with cavities, the cavities happen when we spend too much time on the demineralization side of the spectrum and not enough time at the remineralization. So whenever we consume something that's basically not water, the pH of our mouth drops down. And depending on the acidity of the food, it might drop down below that critical pH of 5.5. Well, it takes the mouth on average about 20 to 30 minutes to reset the pH balance of the mouth, to buffer the acidity and for it to get back to resting levels. And also the caveat that folks with dry mouth, people are on with xerostomia, people that are on multiple medications, have like Sjogren's syndrome or like autoimmune disorders and stuff like that, they might have more predisposed to xerostomia, so they may never get, without help, they may never get that pH balance restored.
Yeah, for people that are listening, xerostomia is like when your salivary glands are not producing saliva, and the dry mouth predisposes you to have more cavities.
Yeah, and dry mouth is one of the most common side effects of medications, and so it's very prevalent. But in a regular person, it takes about 20 to 30 minutes for the mouth to kind of get back to a more neutral pH. So the very first thing, knowing that, is to make your meals shorter and focused, and not be grazing all day. So you want spans, and you want good amount of time in between meals. And when you consume something, you want to consume it, be done with it, and then not consume it again for quite a while. And that's why I'm a fan of restricted eating windows, intermittent fasting type things, because it's a large part of it is constant grazing or constant sipping. Because if, say, someone drinks a Coke, well, if they drink that Coke in 10 minutes and it takes their mouth 20 minutes to neutralize that before getting back to their resting pH levels, we've been in a state of demineralization for about 30 minutes. Well, if someone gets a big gulp and is sipping on it all day, they're sipping on it every 15 minutes for 6 hours, well, we are now in a state of demineralization for 6 hours, plus the 20 or 30 minutes it takes to reset. And so even though the amount necessarily didn't change, if the frequency is drawn out more, it's going to be a lot more damaging. Does that make sense?
Oh, dude, and now I'm just like, one of my tricks, for coffee is to have a really good insulated thermos, because then you only drink 1 cup and you can drink it throughout, up until like 2 or 3. Now you're making me reconsider. Oh man, now you're making me reconsider. So now I am making my teeth acidic, over. So in short, just like anything, there are no shortcuts to health. What about things like carbonated water? Carbonated water doesn't have any sugar.
Correct. A carbonated water can still be slightly acidic, but carbonated waters, black coffees, unsweet teas, I'm not as concerned about, because they may be acidic, but they're going to just be kind of towing the line to that critical pH. They're not going to be going under it too much. What happens, because when looking at a spectrum, depending on, and this can fluctuate between brands of teas, brands of coffees, and all of that stuff. So, but coffees and teas kind of sit around 5, maybe 5.5. So they're kind of right at that critical zone. But stuff like your sodas, your fruit juices, cranberry juice, not surprisingly when you think about it, but I just didn't know this, cranberry juice has a pH of about 2. It's highly, highly acidic. But a lot of folks who think fruit juice is healthy, they'll sip on cranberry juice not knowing that it's really, really acidic. But so it really depends on the pH levels of those. But I really tell folks, don't freak out about carbonated soda or carbonated beverages, just your like seltzer waters and stuff, your unsweet teas and your black coffees. I'm not as concerned about, as long as folks aren't actively battling dental disease. I just don't worry too much about those. I have plenty of Monster energy drinkers and Dr Pepper drinkers to worry about. So
What about the role of fluoride in the mouth?
yeah, so fluoride's interesting because topically it has been very beneficial for the protection against cavities. That being said, and I still use fluoride, don't get me wrong, but I think my profession as a whole has put too much faith in it, and the fact that it's become kind of a crutch when really they talk about, there's that saying in health, you can't outrun a bad diet. Well, I kind of think you can't outbrush a bad diet, and you also can't out fluoride a bad diet either. It does have some benefits when used in the right context, but it's been overused and over relied upon, in my opinion. And also, there is some recent data that's suggesting that bacteria are now kind of becoming resistant to fluoride, much like any antibiotic
No,
resistance.
totally. And my talk at AHS is on this very subject. Not fluoride, but bacterial resistance and how bacteria is like the most fucking scary thing ever.
Yeah, so there is some data that is suggesting that that's happening with fluoride as well. So that's why I don't really bark about fluoride too much. I don't really have a dog in the fight, except for that we need to be focusing on getting to the root cause of all this.
I've never had a cavity, even before I was paleo, or I've never had a sweet tooth, and I'm not a snacker. Okay, and I'm 36 years old, and I've never had a cavity, and I never thought about meal frequency and how that could affect cavity. But what about the microbiome of the mouth? Remember in college we did a swab of our mouth, and then we like did some speciation of the biome of the mouth. I don't remember if I had a bacteria that helped me not have cavities, but can you talk a little bit about that?
Yeah, so the microbiome of the mouth is a lot like the microbiome of the gut. And we're always going to have bacteria there, and some are actually beneficial, some are benign, and some cause problems. And it's not necessarily the presence of bacteria in the mouth, but it's what constitutes that biome. And so what happens when we are eating highly sugary, highly processed diets, high carbohydrate diets, or that meal frequency that we've been talking about, is that as the pH level of the mouth shifts, you're going to have bacteria that then basically proliferate at a higher rate according to where your pH level of the mouth is. And so if your pH level, resting level, is fairly high and you don't disrupt that too much, then that kind of creates a ground for these more beneficial or benign levels of bacteria. Whereas when we go acidic and we go too long, then we start having a shift in the microbiome to more pathological bacteria, like the most famous being Streptococcus mutans, which is one of the most prevalent drivers of dental caries or cavities. And there's tons other, but that's kind of the most prevalent one. So it's a lot of it is how much time do we spend in that lower pH levels that then cause a shift in that microbiome. And so then if you have a high bacterial load of these pathological bacteria, well, then that's also going to create a vicious cycle. It's going to keep the pH of the mouth low. These are acidic producing bacteria, and that's when they consume carbohydrates, and they basically crap out lactate, and so it creates kind of this vicious cycle that's going on. So people who don't have those problems, don't have those bad bacteria in the mouth, and have healthy levels of good bacteria, they're not really going to have that problem. And so that's why we want to kind of nurture this shift in the microbiome. That should be a very front and center plan for a person's oral health.
Now, is there anything you can do after if you drink some acidic liquid, or if you want to eat a lemon, should you rinse, or what about chewable probiotics, or any strategies?
Right. So there's quite a few things out there. I like at bare bones, if somebody can just swish with some water afterwards. Just drink some water, kind of swish it around. That'll help. And even some of the more higher pH waters are becoming a lot more readily available now too. And so that's pretty cool that you can actually get these pH levels of 8 or 9 water and kind of swish around with those. That could be beneficial. Also, another thing, I do like the probiotics that you were talking about. There are a few out there now that are oral probiotics, so they're kind of like these wafers that you just let dissolve in your mouth. But they usually like for those to be used when going to bed. So and so that way it has time to sit uninterrupted.
Are those prescription only, or?
No.
I used to use Zymogen's products, and I was using them as an ENT probiotic for like chronic sinus infection, and I'm sure it has some benefit in the mouth flora, but they discontinued the product. So do you know any other ones?
The only one off the top of my head, there's a few out there, and I don't have a tie to this brand. It's just what I've used before, but it was by Avora Pro.
Okay.
I can probably get that link to you, their website. But that's the only one that I've had personal experience with. But I think there's a few out there. But throughout the day, it's not really that great because you want to use it. You want to use it at nighttime, so where it's just kind of basically dissolving in the mouth after you've eaten and brushed and all that stuff. You just kind of want to sit in the mouth. So I don't recommend that during the day, but what folks can do other than water would be xylitol-based products. Xylitol is pretty darn interesting in the mouth because going back to strep mutans that we were talking about earlier, xylitol is not metabolized by strep mutans. And so because it's not metabolized by strep mutans, the bacteria doesn't produce acid. It doesn't produce its lactate. It also doesn't reproduce. And eventually, because it hasn't been able to get much substrate, that it eventually dies, the strep mutans. And so xylitol is pretty darn interesting from that effect in the mouth, but also it can help stimulate saliva flow after. And there's also been some research showing that folks, after going back to that pH reset that takes about 20 to 30 minutes, folks who pop like a xylitol gum or a xylitol mint or something like that can get back to that resting pH level in about 5 minutes compared to 20 to 30
wow,
minutes.
That's awesome. When I first started doing paleo, I decided, I'm going to stop chewing gum because there were a couple of like people talking about cephalic response to sugar and how that can create a little bit of insulin release, and you don't want that. But after like weighing things out, I decided that it was more important to chew because I'm pretty damn insulin sensitive. And I wasn't, I'm not experiencing like sugar lows or anything like that. So now I keep xylitol gum with me at all times. for people that are not familiar with the book Jaws or with Mike Mew's work or your work, why is it so important to chew?
Well, it's just like anything else going into growth and development. It's kind of one of those things, you use it or you lose it. And so function and load bearing exercises is critical for basically any part of the body. I mean, that's just like if folks break their arm and they're in a cast for however many months, and you take that cast off, and that arm is significantly smaller than the one that's been unbroken and being used for those last few months. Well, in growth and development of the face, it's the same concept. Now, the thing is with growth and development, this is my personal opinion on it, is that there's so much research that needs to be done on it. It's hard to say what we know for certain, because we can look at stuff like Weston A. Price's work and how these, because he was blown away that these Aborigines and these indigenous cultures, they didn't have any dental crowding, right? They didn't have any overlap of the teeth. They were all nice, broad arches, straight teeth. And he had noticed that once a westernized diet was introduced into these places, that the very next generation they had all sorts of problems, including these dental crowdings. And so that suggests then that nutrition plays a big part of it. Evidence is kind of showing the nutrient density of the foods and fat soluble vitamins and all of that playing a big part of it. And like you said, the chewing of the food, I think, also plays a huge part of it, because it's that feedback, just like anything else, that helps kind of promote growth and development. And so I think chewing plays a big part of it. That's why, like with my daughter, we cut her food up and everything like that, and make it easy to consume. But also, if she wants a snack, I'll give her like a piece of jerky. And she's only 3 years old. I give her like just a piece of jerky that she's going to have to work for a little bit to try to stimulate a little bit of that chewing. Or if I could get her to eat raw carrots, I would love that. But I just can't get her to eat raw carrots yet. I'm working on it.
What about those mesh? Have you ever seen those mesh things that you can put like frozen berries?
Yeah, I have seen those. I haven't used one yet, but I like the premise of it.
Another cause would be to eliminate kids' menus from restaurants, because we should have human menus, and that's it. And kids should be eating adult foods too. But if you look at those menus, what is it? It's macaroni and cheese, chicken nuggets. How many people do you know that say, "Oh, I don't like chicken on the bone"? Like they want pre-processed chicken. And what comfort foods used to be was like, oh, I want some comfort food, maybe steak and baked potato. Now comfort foods are becoming like oatmeal. Like the comfort food is macaroni and cheese. All this soft food. And now we're educating our kids to not chew. And because you're not chewing, your jaw, your masseters, all the different little, muscles within your jaw are not being exercised. And now that affects the jaw structure, because now your jaw, instead of growing horizontally, it's growing on a different plane, and it's making it a little bit more narrow. And because of that narrowness, crowding occurs. So what do we do in modern dentistry? We invented braces, and we think that we need to extract wisdom teeth. And we, as an ancestral practitioner, are there any other ways of addressing this problem?
Right. And so that's why, going back what we were just talking about, diet, eating real food, eating nutrient dense food, that's kind of first and foremost, because that's going to give us our kind of 1-2 punch, because we're going to be getting the right nutrition load, but also real food in a not overly processed way. You're going to get more of that muscular activity for growth and development. Now, I'm also a big fan of, as far as orthodontics go, I also am a big fan of myofunctional therapy. And so that is kind of retraining the teeth, or retraining the jaws, retraining the musculature, retraining the tongue, going through exercises, but also how they should be resting, and to help develop the growth and development of the face. And so, and a big reason I also like doing that is because of OSA, obstructive sleep apnea. And as you know, being a physician, the prevalence of sleep apnea, even pediatric sleep apnea in kids, is just huge nowadays. And there's some theory behind it that this whole underdeveloped musculature of the face is kind of playing a part in that, and that can stem back from whether a kid was breastfed or not, whether, like it. The rabbit hole is pretty deep on that, but I'm really a big fan of myofunctional therapy to retrain the jaw for correct position, the musculature, the tongue. The tongue has very big effects on the growth and development of the mouth, and if it's not in the correct position, if kids or adults even are mouth breathing, they're not nasal breathing. If they are not having the correct swallowing patterns, so they're more of what's called a reverse swallow, where the tongue does not fill the roof of the palate. All of these things lead to arch constriction, and basically a narrowing of the face, like what you talked about, and also a narrowing in the available arch length for teeth. And when we don't have crowding, basically, which is the biggest orthodontic concern, crowding, which is the overlapping of teeth, that is due to inadequate space needed for those teeth. And so that's why all of this stuff, this myofunctional therapy, there are trainer systems, like a series of, like, they almost like mouth guards, and you bite into them. It has a place for your tongue, and you train your cheeks and your lips to kind of close over them. And then you also focus on breathing through your nose. And so it's taking a lot of these mechanics into play.
How long is this therapy?
Well, when I do it, I use a system called MyoBrace. The treatment is usually about a year long. I prefer getting in with it on kids, kind of between 6 to 10 years old, depending on compliance levels. Because they have to wear it for an hour a day, and then they need to sleep with it best that they can, sleep with it at night, and they have exercises to do, and they have how the MyoBrace system works. They put it in a kind of a cool little thing that kind of appeals to kids and everything, so it's neat. But and you can do it as an adult too. They have adult versions, but that's kind of what I use, and treatment time is usually about 9 to 16 months on average, so about a year on average.
What do you think about things like Invisalign?
So Invisalign, it can be great. The technology that they've developed has really come a long way. My thing is with Invisalign is I think that the brand itself, they kind of oversell and try to make it seem like it can do everything, and then so people start to expect that it can do everything. And then some practitioners think that it can be done for everything, and then they're using the wrong tool for the case. So I have no problem with Invisalign. We do Invisalign in my office, but I'm pretty selective with how I use it, because when we're dealing with tooth movement corrections, you have, like what you were talking about earlier, you have the different planes of movement. So you have transverse, sagittal, anterior, posterior, all that stuff. And so basically it works in one or two of those planes pretty well, but it doesn't work in all three planes very well. So with cases that really need attention in all three planes, it's not going to work very well. Does that make sense?
Yeah. So for example, what are some contraindications, or who shouldn't be? Because it's funny, because now there are companies that are doing like direct to consumer trays. And I've seen some pretty crazy stories on those. So who shouldn't be DIYing their straightening of teeth?
Yeah, and see that's the thing. Unfortunately, because I'm a pretty free market guy, and I'm pretty entrepreneurial, and so I get what they're trying to do with these kind of direct to consumer things. But when we're looking at teeth, we're not just looking at, to do things right, in my opinion, we're not just looking at aesthetics or if the teeth are straight, but we also need to be looking at function, and we also need to be looking at support. Because if the teeth, while they are straight, if they're not angled correctly, meaning that the root of the tooth is in a proper vector to receive load the way that tooth is designed to do, things aren't going to be very stable. If it's not in a very favorable position in the jawbone, if it's been moved too far out, because you can overexpand, you can push teeth a little bit too far out to make the room, but they're not in a very stable position because they're almost pushed almost outside of the bone. And so there's those issues, and then also how those teeth interdigitate or occlude together when you're chewing. And if that isn't well set up and well balanced, then that can lead to some issues down the line. And so that's why I'm just so wary. And I've actually already seen in my office a couple of cases of those direct to consumer things that didn't really go so well. And now they're having to go through some more stuff to kind of get things fixed back up. And so, but it's one of those things, just like anything, just like keto, for example, it can be a really good tool, but it's not the only tool, and it's not the perfect tool for every job. Does that make sense?
Totally. And we went in on a very, very crazy circle, because I before we go, I do want to talk about how some of the S mutants, there has been some correlation to cardiovascular disease and other disease processes. So what's the connection?
Yeah, so there's still a lot of studies that need to be done. This oral systemic health thing, I just find it fascinating. But my concern is, well, because there are studies showing correlation with like what you said, strep mutans, finding that in plaques, plaques in arteries. There's also, they're finding, upon dissection of Alzheimer's patients, they're finding spirochetes that are usually only found in people with gum disease. And so there's a lot of research coming out that is asking a lot of questions, but the line between correlation and causation hasn't quite been drawn just yet. Now, there is some evidence that suggests that with inflammation of the mouth, it can contribute considerably to the inflammatory burden of the body. And there's give and take there. People have seen like diabetes, for example. People have seen improvement in their diabetes markers by getting their oral health under control. But there's also been people that have had success getting their diabetes under control and then their oral health issues resolve. So it's like a two-way street on that. So I'm leery of the people who really, really point out causation at this time, because I don't think the level of evidence is there yet. That being said, I think that oral health is important enough to stand on its own merits to want to get it taken care of because of it itself, and then any benefit that we get systemically, I think, is a bonus. But then also, folks who are battling these issues, it's important to think about the role of oral health in that, because will you be able to fully heal if you are getting inflammatory burden by the mouth contributing to your autoimmune disorder, your diabetes, or whatever it is. So like I said, I think on most of this stuff, it's a two-way street.
And it's about looking at this stuff holistically. Like you said, you're not gonna out supplement a bad diet. It's all in balance. And when all of those interventions that are lifestyle, which are the hardest. It's easy to buy a bottle of supplements. It's easy to buy an exercise machine. The difficult part is to actually create the environment where you're going to use that exercise machine, eating the right things. So this is fascinating stuff, and I really want to continue digging through all of this. But what's your vision for dentistry, and how we can get our friends and folks in the dentistry to contribute and help in this war against disease?
Right, and that's kind of where I'm coming from about it. Is first off, I want to, with how I'm doing things with social media and with my Ketodontist podcast show and stuff like that, is I'm trying to generate awareness in both the dental community but also to the consumer, because if patients start seeing the connections and patients start wanting a dentist that pays attention to this stuff, creating that demand will then, in my opinion, will kind of help nurture dentists to want to start incorporating this into their practice. And I'm sure you see it in medicine. Unfortunately, a lot of the system is just kind of focused on reactive care versus preventive care, right?
And I keep talking about this. I mentioned a couple of times that even me in a niche, in a self-selected group, naturopathic medicine within the ancestral health, within endocrinology, where people are following me on social media and sometimes flying across the nation to come in. When they come to see me, we are still doing sick care. And it takes, for me to balance their hormones and maybe lose some weight and then feeling better, to start doing preventative care. And I'm like pretty niched out and very like selected,
Yeah, you're a minority of a minority, my friend.
Yeah.
Like you're
and when people come in, they already know about paleo. And they all, and I'm still doing sick care. I cannot imagine what our other brothers and sisters are doing.
right. No, I fully agree. And so, really, one thing that I'm trying to work on in my office is kind of developing a system or a template that if successful, other dentists can then possibly use and start incorporating their own practices. And really, it's nothing radical. It's just a different way of kind of viewing things, and kind of like in functional medicine, how it's things are systemized, right? And so I would like to see something like that in dentistry, but not just in a lot of folks are doing things systematically in dentistry, but they're just focusing on the mouth, and I want to upfront the process and more of kind of diet and lifestyle first, and then build the dental part on the back end of that. Does that make sense?
Oh, totally, totally. It makes total sense to be, not to be reactionary and to actually try to address, So, Dr. Matt, where can people find you? How can people get a hold of you if someone wants to, go see you in the middle of nowhere? Where can how can they make an appointment?
Well, that's why I started, because I am in a very small rural town, and I love where I'm at, and I love treating my patients here, but I wanted to have a bigger impact. And luckily, just like technology that's allowing us to do our thing right now here, um, it's allowed me to kind of get the information out there on a broader scale. So you can find me on social media. I'm at Ketodontist, so it's a little play on word of a specialty of dentist plus keto. So you can find me at Ketodontist on Instagram, on Facebook, on Twitter. You can shoot me an email, ketodontist@gmail.com. I do have a Ketodontist website, just ketodontist.com, but it is going to be going through some major renovation here pretty soon. So, but I do have a website. I have the podcast on basically anywhere podcasts are found, and then or just shoot me a message on Facebook. That seems to be the most popular way to do it.
Awesome. Thank you so much. This has been, I love talking about oral health. I've had struggles with my own oral health, and I usually, and I'm always trying to look for ways of improving it and making it better. Big takeaway, I've been pretty crazy about high pH water. And like
Right.
how it's not going to affect your overall pH, and to prevent cancer or whatever. So I tell people, just take a deep breath and you'll normalize your blood pH. But now, after learning this, I'm gonna start. Every time I pick up a bottle of water, like at the store or whatever, I'm gonna opt for the high pH water to change the pH of my mouth.
That's the only reason I buy the stuff, is just for that reason. Yeah, you're not gonna elevate your blood acidity or blood pH by any means.
Yeah, that's fascinating. Thank you so much for your time. We've been going back and forth for a while about this interview, and it finally happened. But let's maybe do a Facebook Live in like a couple of months or whatever, and we'll answer questions. For your peoples and for my peoples, and if they have questions about endocrinology, or if my people wants to talk about teeth and jaw care.
Right, sounds great.
Yeah, thank you so much, and I'll talk to you soon.
All right, thanks for having me.